Crohn's disease is an inflammatory bowel disease, causes inflammation of the lining of your digestive tract, and that can lead to severe abdominal pain and diarrhea.
While there's no known cure, Chelly Boutott tells us treatments can greatly reduce the symptoms and even bring out long-term remission.
Crohn's disease may affect as many as 700,000 Americans, and there are different treatments that can ease the pain for sufferers. After years of pain, Miranda Schutt is finally able to live her life.
I feel a lot more normal, and I have good days now, and I don't have a fear of always being in the hospital.
Her abdominal symptoms began when she was 17 and continually got worse.
I kept going in for tests, and they kept just saying, "You're fine, it's just you're stressed out."
Miranda was treated for a variety of ailments, but wasn't diagnosed until 3 years later in the emergency room.
They thought it was my appendix, so I went in to get my appendix removed, and come to find out it's not my appendix, and lo and behold, I had Crohn's.
She received treatment. It worked for a while, but then the pain came back.
It really affected me. I was locked in my home or I was in the hospital, and so it wasn't a good way to be living.
It was the final straw for her husband, Dean, who sent her to Aurora BayCare Medical Center, and Dr. Erik Johnson, who discovered the Crohn's had caused strictures and fistulas.
Through a combination of surgery and different medicines, we've got her feeling much better now.
Dr. Johnson suggested a combination of treatments.
This type of disease, it's worth looking at various options, because sometimes there are different medicines that are on the horizon.
At Aurora, the surgeons, doctors, and patients work as a team.
We all work together really well, and so I knew this was the place I needed to be because of how they treated me, how they worked together, and I was a lot more educated. Miranda's goal is to go into remission, and hopefully someday there is a cure, which is why she is raising money for the upcoming Crohn's Walk. Aurora BayCare is presenting the fundraiser. Green Bay Takes Steps for Crohn's and Colitis is on Sunday, June 22nd at Aurora BayCare Medical Center. The festival and check-in begins at 4. The walk is at 5:30. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Chelly Boutott, Local 5 News HD.